Washington is full of noise, but here we cut through it. I'm Ryann Hill, your trusted voice on healthcare, aging, and disability policy. On Mic'd Up, I sit down with the people driving change to share their stories, insights, and strategies in the Beltway and beyond. Welcome to Mic'd Up with Ryann Hill. Hi, everybody, and welcome back to Mic'd Up with Ryann Hill. I'm Ryann Hill, and I'm so glad you all are here. This show is about cutting through the noise in Washington to bring you real conversations with people who are actively shaping healthcare, aging, and disability policy. Today's guest is someone who really embodies that mission. We have Davion Percy, who is the Vice President of Community Relations and Public Policy at Luminis Health, where he leads the system's efforts to build partnerships, influence public policy, and advance health equity across the region here in Maryland. Davion, thank you and welcome to Mic'd Up with Ryann Hill.
Hi, Ryan. Thank you so much for having me on, and congratulations on your podcast. I'm very honored to be among the guests of your first season. So thank you.
Thank you. This is something that I pitched to him months ago before I even had a first guest lined up. I said, Davion, I need to have you on the podcast. I think it's really important to learn more about, what's happening at different state levels. And as a Maryland resident, I think that Maryland is doing so many things correctly. And who better than to talk about someone who is on the ground in Maryland doing the work. So why don't we start with your story, Davion? I really want people to get to know you. You've built such a strong reputation in the state of Maryland, both at the county level with Prince George's County and also at the state level in Annapolis. I would love to know, how did you get into this work and what keeps you passionate about state policy today?
Yeah, well, I'll keep the story short, but it's a pretty long and interesting story about how I got into this work. But as you said, I started out in Prince George's County, worked in the county government for 10 years. 5 of those years, I worked in a couple of agencies in the executive branch. In the last half of that decade, I worked in the legislative branch, where I started out working in constituent services and eventually became chief of staff to a county council member, who also at the time chaired our health committee. And then while working with her, my family unfortunately suffered a tragic a medical tragedy where we lost a family member, which caused me to kind of delve a little deeper into healthcare policy with everything that we deal with as people of color in the
Mhm.
healthcare system. It was unfortunately one of those stereotypical results that we've seen for decades now in the American healthcare system. Little did I know, I was also being vetted by a law firm to join their government relations team. I was later recruited, and I joined their government relations team and absorbed a portfolio that included a significant amount of healthcare clients, and continued to lobby on healthcare issues and others during that time. And I was later recruited to what was then my client and now my top my employer, Luminis Health, leading their public policy and community relations portfolio.
Absolutely love that. So when you talk about, sort of that transition between working for an organization, external, and then going in-house, one of the things that, struck me as we were leading up to this conversation is that you mentioned that the ER is right by your office and the helipad is right by your office. And so thinking about just how real those things feel, and I'm sure as you look at those things every day as you go into the office, you're able to connect the work that you do at the state level to those services that so many people lean so heavily on. So that said, you do a lot of things at Luminous, and it feels like Luminous has a really deep presence in the region. I know I'm always driving by a Luminous facility and the parking lots are packed. For listeners who may not be super familiar, can you tell us more about Luminous, what makes it unique, and how it's serving the community?
Yeah, well, Luminis Health, we're a regional healthcare system here in Maryland. We have three hospitals, two acute care hospitals, which are hospitals that the general public can go into, the hospitals with emergency rooms, and we have a behavioral health hospital. So that's J. Kent McNew Medical Center, which is focuses on behavioral health, and Arundel Medical Center, which is right in Annapolis, and Doctors Community Medical Center, Community Hospital in Lanham in Prince George's County. And we also have over 100 outpatient practices throughout the state serving about 1.5 million residents across 8 counties. What's important to us is community. And we want to make sure that we are intentional about building strategic partnerships with our elected officials on all levels, but especially at the state level, because those decisions have a direct impact on us. But also, we want to make sure that we have a presence in the community that allows us to bring healthcare close to home as much as possible and to keep you out of the emergency room. So we're very active as part of the work that we do. Most of the executives here, our work goes beyond the four walls of the hospital.
Mhm.
There is some required community component to it. I just happen to be fortunate to be vice president of community relations because it's one of the favorite things that I like to do.
I love that. And so that huge numbers, it feels like, in the state in terms of the number of facilities, in terms of the people that you're serving. So tell me what's happening in Maryland right now. I say all the time, I dibble and dabble into state health policy, but I am primarily a federal girl. And I like mostly to stay that way, but there are some states that, as I said at the onset of this conversation, that I think are really doing some interesting things. So, can you tell us more about, some of the biggest policy or political conversations that are shaping Maryland's health policy view for the balance of the year?
Yeah, so Maryland is very unique in which we have a unique healthcare delivery system than literally any other state. And right now, that system is in transition to a new model. So what's the biggest conversation right now is how do we implement what that new system looks like, first of all. How do we implement that new system to ensure that the quality of care remains the same, that our
Hmm.
hospitals stay open, and everyone can have access to care? So that's what's first and foremost most important. The
Hmm.
second thing that we're working on is reduction of ED wait times throughout the state. We have some of the longest wait times in the nation. Prince George's County has some of the longest wait times in the state. Fun fact, Anne Arundel Medical Center, where my office is located, is the busiest emergency department in the state of Maryland.
Oh, wow.
So, finding ways to be more innovative to reduce ED wait times is very important. We're represented on the state ED wait times task force as well as Prince George's County's ED wait times task force. The third thing that we're working on that's a top priority of the state, especially depending on where you are in the state, is equitable access to care. So we're learning through different studies, which is something that we've known for a while, but we have a physician shortage throughout the
Hmm.
state,
Hmm.
especially in one of our main jurisdictions in Prince George's County. There's a
Hmm.
primary care shortage in that jurisdiction as well as some specialties. So when that happens, we find in those areas that many residents end up using the ED as their primary care. And by the time they come to us, their care has been delayed, that preventative care hasn't
Hmm.
occurred. So they come at a higher acuity or more severe medical conditions than they would if they had to come to the emergency room in the first place, had they had access to care close to home. So those are top priorities of the state, and at Luminis Health, those will remain our top priorities in line with the state. So
Hmm.
we're working directly with the state and through the Maryland Hospital Association to address some of those issues.
That sounds really, really interesting that you talk about, just how connected some of the policy priorities are, and then, what it looks like actually on the ground. I know we talk a lot at the federal landscape about, you know, the implications of different policies, right? But it's so interesting to hear about, when you talk about, folks needing to go to emergency departments in those wait times and coming and presenting with higher acuities and needing and having more severe issues. I think that that's something that, the mic'd up listeners really need to hear, is be able to connect dots. I think we talk all the time about, data and making sure that policies actually move the needle. And I think what better way to talk about policies that can move the needle than by doing, serving on the different task forces that you mentioned at the county and state level. I think that's really awesome. And I'm really, as a proud Maryland resident, I'm very happy that our state, is having these conversations, and I'm sure, has had these conversations for some time. And I'm really looking forward to seeing what comes about, what are we able to see more synergies? Are we able to see, more like what is this increased coordination between state and public and private sector entities lead to. So I'm really interested to learn more about what you guys have going on in the task forces and working with the state. So let's spend a little bit more time talking about Annapolis, which I've only been to like twice at this point. I feel like a bad Marylander, but I will tell you, when I was in elementary school and you had to memorize the state capitals,
Hmm.
I always got Annapolis right for Maryland.
Yeah.
So really great from that perspective. What do I know about it? Other than that, I've been, like I said, twice. It's beautiful for those of you who have not yet been or seen pictures. It is an absolutely stunning city, town, and you know what it really is. But it's a nice little retreat from the hustle and bustle of DC. So you talked a little bit about, what the state priorities are. Let's talk more about Annapolis and the state house and the state senate. So can you tell us like more about the fundamentals? When is the session? When does it start? I know every state may operate on a different sort of session calendar, but would love to know more about the timing of the session and what are your top priorities for, I guess, a forthcoming legislative session in the state of Maryland, and how you were able to connect what's happening on the ground and in your hospitals and communities to what you're pushing for in Annapolis.
Yeah, absolutely. So first of all, I love educating people about Annapolis, so thank you for asking that question. The legislative session runs for 90 consecutive days, beginning the second Tuesday of January
Hmm.
every year. So this year it begins on January 14th, I believe, and runs through April 14th. That's by Constitution. The interesting thing about it is that the only thing that the legislature is required to do is to pass a balanced budget. If they don't accomplish anything else during that year, healthcare, education, anything, as long as they pass us a balanced budget, they've concluded their jobs.
Oh,
However, we have many issues that we have to deal with. About 3,500 bills are introduced every year during that 90-day session,
wow.
and most of them, if not all of them, get a hearing. They're required by law, and about maybe 700 or so actually make it to the finish line and
Hmm.
get to the governor's desk. There are exactly 188 legislators, so 141 members of the House of Delegates and 47 senators, and with super majority of Democrats. And I must say, it's one of the most diverse state legislatures in the entire nation,
Oh,
and
wow.
it has the largest state legislative black caucus than any other state. So as you can see, I'm proud. I'm a proud Marylander as
Yeah,
well, and
I know.
proud of the work
Mhm.
that we're doing in Annapolis. So, in terms of our priorities, there are a couple things that we're going to go in a session focus on that our states focus on. Number one, we know that there are changes coming as of where there are changes coming to Medicaid.
Mhm.
We are preparing to make those changes. Given the timeline, we're blessed with fortunate with our model that it doesn't impact us like it impacts other states. But that's number one priority for our state legislature. And the second priority for us that aligns really is around maternal health, and
Mhm.
our third is behavioral health. So what we've seen is that there's a significant need for increase in behavioral health services. The challenge is how do we deliver those services in a way that we can pay for them and make sure that the proper um, those who need the services the most get them, and then also in certain jurisdictions, like in Prince George's County, as I said, we're the second busiest. Oh, I didn't say this actually. So, in addition to us being the busiest emergency room, Anne Arundel Medical Center is the second busiest birthing hospital.
Mm.
So, Holy Cross delivers the most babies per year in Maryland. Anne Arundel Medical Center delivers the second most, and then the rest. Well, a good portion of the deliveries that come to Anne Arundel Medical Center actually come out of Prince George's County
Hmm.
because
Yeah.
there aren't enough facilities to deliver babies in Prince George's County. So maternal health is not only a top priority for us here at Luminis Health because we operate in both Anne Arundel and Prince George's County. It's also a top priority for the state
Mhm.
and the county. So we've been working very closely with the governor and the legislature, particularly in the Appropriations Committee, to get funding to build the Women's Health Pavilion that we're building over at Doctors Community Medical Center. And that was a true partnership. When you talk about collaboration, this is a collaboration between the county, the state, and us. And we're all going in this together, helping to fund this facility for the common good of the residents that need them most.
I want to drill on a little bit more about the maternal health piece. I know that maternal mortality, maternal negative postpartum implications are. I feel like it's something that we talk about in the federal health policy space quite a bit, right? Like there are members of Congress who are champions of maternal health caucuses who put forward a giant legislative packages like Lauren Underwood and the Momnibus, right? I'm on the board of a group called Women in Government Relations, and last year we held a maternal health summit where we brought forward, advocates and people from the community, and also we had a few policymakers. We had the First Lady of New Jersey come speak, and we also the year before that had Representative Lauren Underwood herself come speak. As a mom of two, I have two little boys, and also just someone who just cares about making sure that moms can deliver as healthy as possible without any of the sort of issues that we see often. Can you tell me more about why you guys decided to focus on Prince George's County, what the implications were, and then what you're hoping to solve for as you're opening up this new pavilion that you did such a great job on collaboration with?
Yeah, absolutely. So, it's a startling statistic when you talk about health disparities, particularly in maternal health in Prince George's County. So, 80% of expectant mothers in Prince George's County have to leave the county to deliver their babies. And keyword, they have to. It's not because they want to, it's not because that there's a lack in the quality of care, but there are not enough hospitals in the county to deliver children. That also means that there are not enough OBGYNs
Mm.
because they're mainly tied to hospitals, birthing hospitals,
Yeah.
which also means that these mothers generally are not getting the prenatal care they need and all of those services. So and that also means that speaks to the statistic where Prince George's County maternal mortality rate is about 50% higher
Wow.
than a national average. So looking at those statistics through different studies that have been done, we decided that it's important for us to focus on bringing maternal health and general women's health services to Prince George's County. The hospital in Prince George's County, Luminis Health Doctors Community Medical Center, currently is the only hospital in northern Prince George's County, serving about a 500,000 residents.
Wow.
So, most of those residents, if they have to deliver babies, they're going over to Montgomery County, into DC, or they're coming into Anne Arundel County at Anne Arundel Medical Center. So we
Mm-hmm.
believe, number one, regardless of what the healthcare need is, that everyone deserves to get healthcare, access healthcare close to home. And
Mm.
your zip code should not determine the quality of care that you have or the access to care.
Preach.
So what we've been doing, thank you. So we're embarking on a $238 million project to build this facility on the campus of Doctors Community Medical Center. In addition to the funds that we've secured internally, the state over the last few years has given us $45 million
Oh,
dollars,
wow.
and we're going back to the state to get more money. This started when Angela Alsobrooks was the county executive, now U.S. Senator,
Hmm.
and with our current county executive and state representatives, this effort is continuing. We've also, in preparation for that, there are also other needs. So we've expanded some of our OBGYN practices in the Prince George's County, particularly in Greenbelt, where we've expanded our centering pregnancy program, and we'll be adding more services there. So that's very important. So we believe that this is a critical need in the county. We expect to deliver about 2,000 babies a year, maybe even more, and we're not going to be able to close that significant hole, but
Hmm.
we're going to do our part to at least fill the gap where we can. And we believe that it's going to make a significant impression. We've already hired doctors, and we're continuing to hire OBs in preparation for this, and it's going to be a wonderful service that we'll be able to deliver today into the county.
I love that. So when will the facility be complete? You have a sense of timeline?
Yeah, we're targeting 2028
Okay.
to be able to deliver our first baby.
That's so exciting. And I would just say, as a mom in PG County, I also had to leave the county. I went to Virginia to have both of my boys. I would have loved to been able to stay in the county. And your point about most the lack of OBs is also very well taken. I think that as most expecting parents are looking for to transition care to an OB, that's the first stop that they go to. A lot of folks may not even consider the birthing facility at first. They're considering who their OB is, and if you have more options for OBs, and even more women in the county will be able to deliver their babies in the county. And then I'm so excited for this opening. Please give me a ticket. Love to come to a ribbon cutting or something like that, because I think this is just so cool and so needed for the county. And I really appreciated how you talked about the studies and the data, right? I think that a lot of what success looks like is moving the needle on the data. But first you have to understand it, right? First you have to know what the issues are, know what the data says, and also on top of the data you have to understand sort of the real person impact, like the impact on these families that are having to drive out of the county, or in some cases like my own, out of the state, even though I live dangerously close to Virginia, so it wasn't far at all. But you still have to consider what that does to someone's mental and physical health. So that said, I would also like to hear more about you guys' mental health practices, your behavioral health. I know you mentioned that you also have a behavioral health facility. Would love to know more about what you guys have going on in the behavioral health space as well.
Yeah, so that's a very interesting practice or initiative there, because we would not have been able to do our behavioral health, open up our behavioral health facilities without the partnerships that we had.
Hmm.
So in 2020, we opened up J. Frank McNew Federal, not Federal, Family Medical Center, sorry, here in Annapolis. And in 2022, we opened up the Behavioral Health Pavilion
Hmm.
in Lanham on the campus of Doctors Community Medical Center. Both of those projects would not have happened without the collaboration with our local government. We worked with Anne Arundel County to open up the McNew Medical Center, and we worked very closely with Prince George's County to open up the BHP, or the Behavioral Health Pavilion, at Doctors Community Medical Center. The interesting thing about the facility is that we are among the first to offer behavioral health urgent care. Now,
Oh.
what does that mean?
Huh.
So, you can walk into our facility and just say, you know what, I'm not feeling it. Something's off.
Mhm.
I need help right now. And we'll provide you with the help that you need. We also encourage that you do regular checkups. You
Hmm.
can schedule a mental health checkup, just like you do your annual physical. We think you should do a checkup, a check-in with on your mental and behavioral health. We also offer substance use disorder treatment services. We offer all kinds of services there, partial hospitalization programs at both of our facilities. So our behavioral health facility is more regional. We're looking at potentially expanding it in the future if the need arises.
Hmm.
But one of the challenges we have is the rates, the cost of providing the care.
Yeah.
We don't recover that cost, especially on Medicaid. So we continue to advocate on the state level
Yeah.
for increased reimbursements. However, we continue to provide the service that we provide because it's needed in the community.
Mm-hmm. And thank you for first of all, thank you for sharing that. It's really good to know that you guys are doing such great work, and especially I think so close to, where the people are, and really trying to meet them where they are. I know we talk a lot about some of the health stats in Prince George's County, but I think also nationally, right? You have, increasing behavioral health issues, increasing mental health issues, all across the country. And I'm sure that, there are other folks who are doing similar models, but it's just so good to know that we have, a really bomb group in Maryland that is targeting this firsthand. So we talked a lot about collaboration, and I think that if our guests can take away, if our listeners can take away one thing, is that you have to work across systems, you have to collaborate with policymakers, with advocates, with community organizations, to help to navigate, some solutions. So, can you tell me a little bit more about how just that how are health systems, advocates, community organizations working together to influence state policy in some of these meaningful ways?
Yeah, there's several ways that we're working together. So first, I'll start with the community side. At Luminis, we have a patient family advisory council
Mm,
and we have a community advisory council for both of our hospitals. These are made up of patients, family members, members of the community. They can give us direct feedback about what the needs are, not only how we can improve care within the hospital setting, but it helps us kind of understand what the gaps are from a policy perspective. We also partner with our sister hospitals or health systems or other health systems within the state where we have similar interests. So, there are 49 acute care hospitals in the state. I believe we have
mm,
about 63 hospitals and health systems
wow.
all together. From the outside looking in, a lot of folks think that we're all competitors. We don't like each other. This healthcare system doesn't hang out with that healthcare system, and we're all trying to beat up on each other. That's not always the case. Most of the time, we're very aligned, and where we can align, we advocate together,
Yeah.
whether it's ED wait times or access to care, rural hospitals, all those different things. We work together on. Then also, we collaborate with different associations on different issues. To mention ED wait times again,
Mm-hmm.
well, an important partner in that is the American College of Emergency Physicians,
Mm-hmm.
right? So we
Yeah.
want to hear from our ED docs. We want them to work with us. We want
Mm,
them to represent us on these task forces. Go with us to Annapolis.
yeah.
So those things that we collaborate on, and then also um, one issue that's very controversial, but I'll just kind of mention it across the board that all hospitals are aligned on, which we collaborate on, is the issue of insurance denials.
Yeah.
We have a major challenge with that. That is
Mm-hmm.
not only a business practice that challenges us sometimes, but it's the policy and the gaps in policies and regulating that. So we
Yeah.
work closely with advocating for that. Then the other that we've been collaborating a lot on, especially with our those in the pediatrics field, is a pediatric overstay. So children who are in our hospitals and they're in our hospitals too long. They
Yeah.
don't deserve to be there, that beyond what's medically necessary. And unfortunately, because of a number of factors, that happens all too often. And we're
Mhm.
working very closely with our partners across the state to advocate to the state to resolve this issue.
There's so many things that you mentioned in your response that I feel like low key triggered me. As you know, I spent about 6 years in health insurance, and then I did a brief stint in hospitals. And so I'm just here like, yep, and the bill for that is this number, and yep, and the bill and the person addressing this is this number. And so again, for most of our listeners are more in tune with the federal policy side, and it's just really great. Although I'm a little bit triggered thinking about insurance denials and also issues like prompt pay, right? Making sure that
Yeah,
hospitals are getting the payments that they deserved from some of these providers. It's important to think about just why these bills at the federal level are so important, and then can help folks like Davion, entities like Luminis and others, and some of their community and other healthcare partners in making sure that they can address the needs of their patients and move forward from an innovative perspective. So, just wanted to connect some federal policy dots there for some of my listeners who may also be triggered by at the thought of like a prior authorization or prompt pay or or overstay bills, anything of that nature.
yeah, absolutely. Federal policies are very important. The good thing about implementing certain federal policies is that it applies across the board.
Hmm.
However, where federal policies fail or where there's a gap, then the states pick up,
Yeah.
right? So, for instance, Maryland during COVID, we passed the Preserve Telehealth Act. of like 2022, 2023, all up. We had some temporary provisions that mirrored some of the federal
Mhm.
provisions in the continuing resolutions. And then in 2025, we passed the Preserve Telehealth Act of 2025 that made some of those provisions permanent. So that in the event that for whatever reason, be it a shutdown, a policy change, et cetera, those provisions did not apply under the federal guidelines in Maryland. We have state law that has protected us from most of that. So while we continue to advocate through our partners like the American Hospital Association, through the governor's office, through our other federal partners, our Maryland delegation, et cetera, we also have a good backstop in Maryland, where Maryland kind of fills in that gap, and we've been doing a wonderful job at that. And so there's definitely a connection between the federal and the state level. And as much, I see we got a little competition here because I don't want to be a federal GR person. I don't envy you at all. But I thank you for the wonderful work that you do. And as much as you all are up there affecting change there, we have to remember that the states also has our back.
Yeah, I love that. So just one, I want to end with one question for you. I think that this conversation has been such a great reminder that innovation often starts at the state level, and that there's a lot of cool things that states can do. So for all of my other, federal policy wonks, let's take a look at some states and see what they got going on. So final question before I let you go for the day. For those who care about healthcare access and equity, we've talked about access and equity quite a bit in this conversation. What is maybe one thing they can do to get or stay engaged or even make an impact in state level policy decisions?
So, the one thing I'd say is I want to say get engaged, but that's the
Mm.
question, right? But absolutely.
Yeah.
But get connected.
Mm.
Get connected. There is a lot of focus on the federal level, as there should be. But many residents that want to get engaged are not fully aware of what's happening on the state level. So go to your state's legislative website, find out who your local legislators are, your state senators, your state delegates, or state reps. Then also find out who's on the health committees. In Maryland, we have the Health and Government Operations Committee in the House. And in the Senate, we have the Senate Finance Committee, which covers healthcare. And follow them, follow what's going on, and lend your expertise and or your life experience to whatever policies they're working on. That's very important because most legislators are not subject matter experts in the policy realms that they're working in. So they need to hear from us, advocates, whether you're in this field professionally or you're just Joe Blow on Main Street who wants to make sure that your voice is heard. So please, please, please get engaged.
Thank you so much for sharing that. I think it's an important reminder that elected officials are here to help you, and that is at the local, state, and federal level. So, as a phrase you and I are very familiar with, closed mouths don't get fed, and so you got to make sure
Absolutely.
that you are talking to people and letting them know what your issues are. So, Davion, I just want to thank you so much for joining me and for bringing such a rich state and local perspective on really important healthcare matters. I think that your work and leadership are such powerful examples of how policy can really transform communities. And I'm looking forward to hearing about all the cool things that y'all have going on as soon as you can release some more information. So, to the listeners, thank you guys so much for listening. Thank you for tuning in to the second episode of Mic'd Up with Ryann Hill. If this conversation resonated with you, subscribe, share with a friend or a colleague, and always help us keep amplifying the voices shaping policy. And a super special shout out to our friends at Rex Wallace Consulting for their generous support of Mic'd Up. I'm Ryann Hill. Thanks for listening, and I'll see y'all next time.
We all know quality isn't optional. Success in Medicare Advantage and Medicaid demands relentless focus, using data, engaging providers, elevating member experience, and embedding quality in your culture. At RWC, quality is our DNA. Our clients outperform the industry, and our Net Promoter Score of 94 says it all. Whether you're aiming for 4 stars or exceeding Medicaid benchmarks, redefining success in Medicare and Medicaid begins with RWC, because we catalyze cultures of quality.